I'm under the impression that one of the frontiers of medicine is that it would become much more individualized to somehow tailor it to a given person's body. How far away are we from that? Of course, there are all these other catastrophes that may befall us before we get there, but
It's a great question. I think that's exactly the right question to ask for cognitive neurologists. And in some ways, we've made these incredible strides. So if you take Alzheimer's disease, so what is Alzheimer's disease? What did Dr. Alzheimer actually discover in the early 1900s? He looked at the brain of someone who had memory loss, and he saw two structures. One was we now think of as called plaques. They're made of a protein called amyloid. Another one we think of as tangles. They look like sort of pieces of spaghetti inside of neurons. We know now that's caused by a protein called tau. So that's what defines Alzheimer's disease: amyloid and tau proteins building up in the brain. For the longest time, we were totally unable to figure out who actually had that unless they had already died. We had to look at their brain under a microscope.
yeah.
But now we actually have the tools in someone who's alive to figure out, do they have elevated amyloid? Do they have elevated tau while they're living? So we can actually define the molecular signatures of their disease without ever opening up their skulls or without them passing away. So we've actually made these incredible strides in individualized medicine. This was a huge problem before, where we were enrolling all these people in drug studies for Alzheimer's disease, and it turned out many of them didn't actually have Alzheimer's disease. We just couldn't figure it out. But
So
now
is
we
it
can.
is it a blood test?
The test I'm thinking of is what's called a PET scan. So they essentially have people come in, they give them
Okay.
a injection of a tracer that sticks to amyloid or sticks to tau, and
Ah,
then they take a picture of the brain and they figure out where did the tracer go.
yeah. Remind me what PET scan stands for. What's the PET?
So the PET scan, essentially, each of these tracers has a radioactive tag, and so when you take the picture, you figure out where is that radioactive tag located.
Yeah. But what does PET stand for?
It's called positron emission topography.
Of course.
But to be honest, I couldn't tell you exactly what each of those words mean.
Okay. Okay.
So I can fill in the blanks, but I can't really fill in the blanks.
Yeah. Yeah. Now, you mentioned that your work now has moved a lot towards writing, like as an illustrated in this book, and I'm sure you must be aware of Oliver Sacks and the man who wrote the book, the man who mistook his wife for a hat, and others. Incredible author and so on. Do you feel any kinship with him and what he was doing? Is that the kind of writer that you see yourself wanting to be?
Yeah, I would say that I would be embarrassed to even do any sort of comparison. But he really created this field. He's the first one who started writing about patients with cognitive changes, and he sort of broke the whole thing open. He
Yeah,
really established this entire practice.
right.
And when I was trying to write the book, I tried to use him as a model for how do you tell the narrative of neurological illness, because he does such a beautiful job of describing particular patients' diseases. And then he moves on more towards the sort of philosophy of it. And then I sort of move on more towards the medical history. And for that, I tried to use Siddhartha Mukherjee as more of a model. He's the one who wrote The Emperor of All Maladies, Gene. He's a beautiful storyteller, and he does an
Uh-huh.
impeccable job telling the tales of scientists and bringing them to life.
Yeah.
Um, but Oliver Sacks really broke this entire thing open. He established the field essentially.
Yeah.